अस्सलाम वालेकुम स्टूडेंट्स। तो हमने स्टार्ट किया था द चेंजेस इन द एक्यूट इन्फ्लेमेशन और उसमें हमने वास्कुलर चेंजेस को पढ़ा था। अब दोस्तों हमारे साथ है सेलुलर चेंजेस आर द सेलुलर इवेंट्स। तो इसको हम डिफाइन करते हैं एज द सीक्वेंस ऑफ द इवेंट्स इन द जर्नी ऑफ ल्यूकोसाइट फ्रॉम ब्लड वेसल टुवर्ड्स द साइट ऑफ सेल इंजरी और द इंटरस्टिशियम इज नोन एज सेलुलर इवेंट्स। सेलुलर इवेंट्स में हमारे साथ क्या होता है? द इम्यून सेल आर migrated from the blood vessel and to the interstitium. And the cellular events may be intravascular events, which include margination, adhesion, and the transmigration, which is also known as diapedesis. And the extravascular events include the chemotaxis and the phagocytosis. अब बात करते हैं about the type of the inflammatory cell. तो सबसे पहले हमारे साथ है न्यूट्रोफिल्स। तो न्यूट्रोफिल्स आर द फर्स्ट सेल टू रीच द साइट ऑफ द इन्फ्लेमेशन एंड दे आर prominent in the acute inflammation and the neutrophils have multilobular nucleus. दूसरा हमारे साथ है the monocytes are the macrophages. After 1 to 2 days of acute inflammation, these neutrophils are replaced by the macrophages and these macrophages are also present in the chronic inflammation. तीसरा हमारे साथ है the lymphocytes. So the lymphocytes are the prominent cell in the chronic inflammation and they have a unilocular nucleus and this lymphocyte count is also high in the viral infection. इसके बाद है हमारे साथ eosinophil. So the eosinophil have a red nuclei and they are involved in the allergic and the parasitic infection. अब आ जाते हैं about the sequence of the cellular events. तो उसमें सबसे पहले हमारे साथ है margination. तो margination is the localization of the leukocyte from the center of blood vessel towards the periphery near the endothelium. लेट्स सपोज अगर हमारे साथ ये ब्लड वेसल है तो इसमें जो ब्लड सेल होते हैं दे फ्लो इन द सेंटर ऑफ द ब्लड वेसल वेयर इज द प्लाज्मा दे फ्लो इन द periphery but during inflammation when the permeability of blood vessel increases large amount of the fluid in the proteins that is the plasma they leak out from blood vessel into interstitium and inside the blood vessel the viscosity of the blood cell increases and the RBC they shows clumping and they form roilex and this roilex then pushes the leukocyte from the center of the blood vessel towards the periphery which is known as the margination. तो margination में हमारे साथ क्या होता है जो ल्यूकोसाइट होते हैं they are pushed towards the periphery. दूसरा हमारे साथ है adhesion. So adhesion is the process that involve the attachment of the leukocyte with the endothelial cell and the adhesion may be the loose adhesion which is also known as the rolling and the loose adhesion occur with the help of selectin molecule and the second is the firm adhesion which occur with the help of integrin proteins. तो सबसे पहले बात करते हैं about the loose adhesion. Loose adhesion is also known as the rolling and loose adhesion there is the transient attachment of the leukocyte occur to the endothelial cell and loose adhesion the leukocyte attach with the endothelium and then detach. They attach and they detach. That is why it is also known as the loose adhesion. And loose adhesion occur with the help of the selectin molecule. And these selectin molecule are normally present within the endothelial cell and viable pallidal body. And during inflammation, these selectin molecule are expressed on the surface of the endothelial cell. And the selectin molecule may be E-selectin. E means endothelium. So these selectins are present on the endothelium and the P-selectin. P means platelets and these molecules are present in the platelets and also on the endothelium. So E-selectin and P-selectin molecules are the present in the endothelium whereas the silyl Lewis X glycoprotein is present on the leukocyte and they attach with each other. इसी तरह हमारे साथ जो L selectin molecule है they are present on the lymphocyte whereas the glycoprotein cell adhesion molecule they are present on the endothelial cell and to these two complement with each other and they are involved in the loose adhesion. Let's suppose हमारे साथ अगर ये endothelial cell है तो they contain the P selectin molecule and the E selectin molecule and these P and E selectin molecule complement with the silyl S glycoprotein of the lymphocyte and form loose adhesion. इसी तरह जो L selectin molecule है they are present in the leukocyte whereas the glycoprotein cell adhesion molecule are present in the endothelium and these two molecule complement with each other and form loose adhesion. After loose adhesion there is firm adhesion occur and firm adhesion there is a strong attachment of the leukocyte occur with the endothelial cell and the firm adhesion occur due to the integrin molecules and the integrin molecule may be beta 1 containing integrins are the beta-2 containing integrins, and these integrin molecules are present on the leukocyte, and these integrin they complement with the VCAM molecule or the ICAM molecule. The beta-1 containing integrin complement with the VCAM molecule of the endothelium, whereas the beta-2 containing integrin they complement with the ICAM molecules of the endothelium. VCAM stand for the vascular cell adhesion molecule present on the endothelium, whereas the ICAM stand for the interstitial cell adhesion molecule that combines with the beta-2 integrin molecule, and they leads to the firm adhesion of the leukocyte with the endothelial cell. अब इसकी क्लिनिकल इंपॉर्टेंस क्या है तो there are leukocyte adhesion disorder which may be leukocyte adhesion disorder 1 and the leukocyte adhesion disorder 2. And leukocyte adhesion 1 disorder, there is malfunctioning of the integrin molecule occur, and there will be no firm adhesion occur, which will lead to the recurrent infection and delay separation of the umbilical cord. Whereas in leukocyte adhesion disorder 2, there is malfunctioning of the selectin receptors occur and the silyl X glycoprotein occur, and the example include Bombay blood group phenotype. तीसरा हमारे साथ है transmigration, which is also known as the emigration or the diapedesis. And transmigration, there is migration of the transport of leukocyte occur from blood vessels through the endothelial fossa and to the interstitium. And the transmigration occur due to the PKM or CD31 molecule in the collagenases. PKM stands for the platelets endothelial cell adhesion molecule, and the collagenases that are released from the leukocyte, and they causes breakdown of the basement membrane. Normally, the leukocyte, after adhesion to the endothelial cell, they form the pseudopodium-like cytoplasmic extension, and this pseudopodia they extend the pores between the endothelial cell, and they squeeze slowly to the endothelial space and to the interstitium, which is known as the transmigration of the leukocyte. अब जो हमारे साथ है chemotaxis, तो chemotaxis is the directional movement of the leukocyte towards the microbe or the site of the injury. And the chemotaxis occur with the help of specific chemical attractant molecules, which are known as the chemotactic factors. And these chemotactic factors may be exogenous, which include the bacterial products, or the endogenous, which include the complement factors like C5-1N or the leukotriene B4, tumor necrosis factor alpha, interleukin B, and the platelet activating factor. And the last one is the action of steroid. So we use steroids during the inflammation, and these steroids inhibit the process of the chemotaxis. Hence, we use the steroid during the inflammation to reduce the process of the inflammation. अब हम बात करते हैं about the activation of the leukocyte, which is the last step in the cellular changes, and the activated leukocyte leads to the phagocytosis. And phagocytosis is the process by which the microbe and other foreign particles are engulfed and destroyed by the leukocyte, like macrophages and the neutrophils. And the process of phagocytosis occurs in the 3 steps. First, there is the recognition and attachment of the microbe with the leukocyte. Second, there is engulfment of the microbe by the leukocyte, and third, there is killing of the microbe inside the leukocyte. अब बात करते हैं about the opsonization. So opsonization is like adding a jam on the bread and making it more tasty. So it is the process by which the microbes are coated with certain specific molecules called opsonin, and this opsonin increases the process of the phagocytosis. And the opsonins include C3b molecule, which are components of the complement protein, IgG antibodies, some serum proteins like fibrinogen, and the mannose binding lectins. लेट सपोज अगर ये हमारे साथ मैक्रोपेजेस है और मैक्रोपेज और ये बैक्टीरिया है, तो द मैक्रोपेज may phagocytose the bacteria, but when the bacteria is coated with IgG antibody, which is an opsonin molecule, then the receptor of this antibody is present on the macrophages, and its phagocytosis increases. So when the bacteria is coated with the antibody, it is rapidly phagocytosed by the macrophage, and this process of increased phagocytosis is known as opsonization. अब आ जाते हैं about the first step in the phagocytosis, which is the recognition and attachment of the microbe to the leukocyte. So the recognition of the microbe occurs with the help of certain specific receptors that are present on the surface of the leukocyte. Let's suppose the leukocyte, there are certain specific receptors present on the surface which recognizes the foreign particle, and these receptors include scavenger receptor, MEC1 integrin receptors present on the surface of the macrophages and the mannose receptors, which binds to the mannose and the mucose residues of the microbial wall. After recognition and the attachment of microbe to leukocyte, there is engulfment of the microbe occur by the leukocytes. And these leukocytes, they form the cytoplasmic extension around the bacteria, and these cytoplasmic extension are known as pseudopodia, which are formed due to the actin polymerization. And the microbe enters into the cell in the form of vesicle, which is known as the phagosome or the endosome. This phagosome then fuses with the lysosome and they form phagolysosome. And inside the phagolysosome, the lysosomal enzyme degranulate and which causes the killing of the microbe or the invading microorganism. तीसरा है हमारे साथ killing of the microbe. तो the killing of the microbe may either involve oxygen dependent killing or the oxygen independent killing that occur with the help of the enzyme. तो सबसे पहले oxygen dependent killing of the microbe. So oxygen dependent killing may occur due to the formation of reactive oxygen species or the formation of the nitrogen or the nitrous oxide. अब reactive oxygen species हमारे साथ किस तरह बनते हैं तो there is an enzyme known as NADPH oxidase enzyme, and this enzyme itself oxidizes and reduces the oxygen molecule to the superoxide anion. And this superoxide anion form is then converted into the hydrogen peroxide with the help of superoxide dismutase enzyme. And the hydrogen peroxide form then may be converted into the hydroxide radical to the pentan reaction, or the hydrogen peroxide may be converted into the hypochlorous acid with the help of the myeloperoxidase enzyme. This myeloperoxidase enzyme causes the conversion of the hydrogen peroxide into the hypochlorous acid, and this hypochlorous acid then has a killing effect. The superoxide anion, the hydrogen peroxide, the hydroxide radical, and HOCl, they causes the destruction or killing of the microbe, which is known as the respiratory burst. दूसरा हमारे साथ है the nitrous oxide. So the arginine, to the help of inducible nitrous oxide synthase enzyme, they pump the nitrous oxide, and this nitrous oxide is then toxic to the microbe. And the nitric oxide may combine with the oxygen molecule and they pump peroxynitrite radical, which is more toxic and has a killing effect on the microbe. अब हम बात करते हैं about the deficiency of the NADPH oxidase enzyme. This enzyme is involved in the formation of the reactive oxygen species. Whenever there is deficiency of this NADPH oxidase enzyme occurs, no reactive oxygen species will be formed, and hence there will be no killing of the microbe, and it leads toward the development of the chronic granulomatous diseases. So the chronic granulomatous disease develop in the absence of the NADPH oxidase enzyme, and the clinical features include recurrent infection in the granuloma formation. And the chronic granulomatous disease can be diagnosed with the help of nitro-blue tetrazolium test or the dihydrorhodamine test. अब दूसरा हमारे साथ है ऑक्सीजन इंडिपेंडेंट किलिंग. So oxygen independent killing involve the destruction or killing of microbe with the help of enzymes that are present in the form of the granules. And these enzymes include lysozyme enzyme, defensin molecule, lactoferrins, proteases, hydrolases, the major basic protein that are released from the eosinophil, and the cathelicidin proteins which are released from the neutrophil. And these catelicidins are more effective against the Mycobacterium tuberculosis. अब हम बात करते हैं about the neutrophilic extracellular trap or the NEAT. So the neutrophilic extracellular trap is formed from the neutrophil. Normally, a neutrophil have multilobulated nucleus, but when this nuclear material decondensates and they form a fibrillary network outside the cell, which is known as the neutrophilic extracellular trap. And the neutrophilic extracellular trap is formed from the decondensation of nuclear material of the neutrophil. And this neutrophilic extracellular trap has a higher antimicrobial content, and it is more toxic to the bacteria, and they causes the killing of the microbes and the bacteria. And the formation of the NEAT depends upon the activation of the platelets molecule, when the arginine deaminase enzyme it is activated, and they causes conversion of arginine to the citrulline, and this citrulline then act upon the nuclear material of the neutrophil and causes its decondensation, and they form the NEAT. Whenever the neutrophil extracellular trap is formed, it is constantly exposed to the outside of the environment, and the body may recognize it as a foreign agent, and there may be the formation of the anti-nuclear antibodies against this nuclear material, which leads to the autoimmune disease. The classical example include the SLE, which is a systemic lupus erythematosus. अब बात करते हैं about the chediak heghasi syndrome. तो ये हमारे पास एक autosomal recessive disorder है, and this disorder is characterized by the defect and the fusion of the lysosomal transferase protein. और इस disorder में हमारे साथ जो lysosome होता है वो fuse नहीं होता with the phagosome. So hence there is no fusion of the phagosome where the lysosome occur, and due to no fusion, there will be no degranulation of the lysosomal enzyme. And when the lysosomal granules they do not degranulate, it leads to the formation of the giant granule inside the cell. And which is the formation of giant granule is the most characteristic feature of the chediak heghasi syndrome. And the symptoms of this disease include the recurrent infection, decreased melanin production leads to albinism, or the decrease in the myeloid formation, which leads to neurological symptoms. There may be a platelet defects which leads to the bleeding disorder or the neutropenia. अब हम बात करते हैं about the systemic effects of the inflammation. So systemic effects are also known as the acute phase reaction, which occur due to the certain inflammatory mediators that include the interleukin-1, interleukin-6, and the tumor necrosis factor. And these acute phase reaction include the fever. So fever is the most characteristic feature of the acute inflammation, and the fever occurs because of the pyrogens and the prostaglandin that enters into the systemic circulation and then act upon the thermostat of the body, which is the hypothalamus, and alter its set point temperature and leads to the fever. Second, the inflammation may causes the reactive leukocytosis, which is the increase in the leukocyte count that occur in response to the infection. And certain bacterial infection, there is increase in the neutrophil count occur, which leads to the neutropenia. Similarly, in viral infection, the lymphocyte count increases, which is known as lymphocytosis, whereas certain parasitic and the allergic reaction, there is increase in the eosinophil occur, leading to the eosinophiliा. But हमारे साथ कुछ बैक्टीरियल इन्फेक्शन है लाइक रिकेट्सियल इन्फेक्शन या कुछ वायरल इन्फेक्शन भी है या टाइफाइड इन्फेक्शन जिसमें हमारे साथ लिम्फोसाइट काउंट डिक्रीज भी होता है, ये हमारे साथ एक्सेप्शन है. इसी तरह ड्यूरिंग द इन्फ्लेमेशन देयर मे बी इंक्रीज इन द ESR occur. ESR stand for the erythrocyte sedimentation rate, and the increase in the ESR occur due to the increase in the level of certain plasma protein like C-reactive protein, ceruloplasmin, and the haptoglobin. अब हम आखिर में बात करते हैं about the outcomes of the acute inflammation, effect of the acute inflammation. So the acute inflammation may completely resolve, it may lead to the scarring or the abscess formation, or when it does not resolve, it may progress toward the chronic inflammation. So the first one is the complete resolution. So a complete resolution is the restoration of the normal histology and function of the injured area, and the resolution occurs when there is minimal damage to the tissue, there is rapid elimination of the causative agent, or when the tissue has a capability of the regeneration, or it has a power of the regeneration. In the process of resolution involve removal of the chemical mediator from the site of the inflammation, normalization of the vascular permeability, and the leukocyte recruitment stop, and there is a clearance of the edematous fluid and the inflammatory cells and the debris by the macrophages that causes phagocytosis and the drainage to the lymphatic system. दूसरा हमारे साथ है scarring or the fibrosis. So the scarring or the fibrosis occur when the tissue is damaged extensively. The inflammation occur in the tissues that does not regenerate or has no power of the regeneration. There is extensive fibrinous exudate come out which cannot be cleared by the lymphatic system. The acute inflammation may lead to the abscess formation. Abscess is the pus formation, and this abscess is formed by the organism which are known as the pyogenic organism. And if the acute inflammation does not resolve, it may progress toward the chronic inflammation. When the causative agent is not neutralized, it may lead to the chronic inflammation.